I majored in chemistry in college, and actually as a chemistry major, you complete all of the requirements for pre-med, all of them. So when I was a junior in college, I looked up and said, what do I want to do with my chemistry major? And quite frankly, I didn't want to be a PhD in chemistry, and I had completed all the pre-med requirements. So I thought that perhaps I should consider medical school. Now, I had thought about going to law school, and I looked at the catalog and actually got bored reading the catalog, and so law was out. I do come from a family, my father was a physician, so I think that may have influenced me, but it wasn't the reason that I went into medicine. In fact, I didn't go to college knowing that I was going to be a doctor. Well, I think there have been 2 or 3 incredibly important changes that have occurred. First, at Hopkins, and I'm sure at other institutions like Hopkins across the country, the residents ran the hospital. Attendings simply were not in the hospital after 6 or 7 at night, ever. Actually, I take that back. There was one time in my 8 years at Hopkins when I remember an attending actually being in the hospital late at night. I also think that the other important difference is the degree of feedback that's given now. When I trained, really, there was no feedback. I went all the way through medical school and no one ever told me whether I was doing a good job or not. I just had to sort of know it in my bones. When I was a resident, same way. No one ever told me that I was doing a good job or not. No one critiqued my performance, my notes, the way I cared for my patients. And you know, that's can be a good thing if you're excessively self-confident, but I'm not sure that it's conducive to the best learning environment. Having 3 daughters, I can say with certainty that the childbearing part of a physician's career is a very small part of the longitudinal career. And so I always, when I was the chair, was of the philosophy that you get the best possible physicians that you can on your staff, whether they're female or male, and you then do what you can to support their needs, whatever those needs may be. I was and am passionate about the field of internal medicine. I think that it brings a lot to the table in terms of the care of patients, and so it was a natural fit for me to get involved in an organization that represented internists. And I saw some of my mentors, such as Will Madry from Jefferson, who was the president of the American College of Physicians. So it was a natural fit for me to get involved. I was fortunate enough to be elected governor of the Delaware chapter, which was a 5-year commitment. And in the process, I began to work closely with the national organization. And thereafter, I was elected to the Board of Regents, and I was on the Board of Regents for 6 years. That's the basically managing body of the American College of Physicians. And I still actually do a lot of work with the education division of the American College of Physicians through the Medical Knowledge Self-Assessment Program, of which I'm one of the deputy editors. Well, of course, one of the first people that I remember, even before I actually set foot at Christiana Hospital, was Leonard Lang. And I really enjoyed his unique take on medicine. But clearly he was an outstanding clinician, and in the old school sense, he did a careful physical exam. He really knew his diseases well, particularly things like tuberculosis, and he challenged others to rise to excellence. So I had a lot of admiration for him, for Bill Holloway. And Bill Holloway, who I had found later, is literally known across the country for his infectious disease symposiums that he planned right here in Delaware. I first went to work for Bob Flynn, and he was a fabulous person to work for. His philosophy, which I adopted, was basically to hire someone that you knew was a good physician, and then basically let them gravitate to their areas of strength. So I used to care for a lot of inpatients on the Wilmington service who had AIDS. In fact, so many that we would have literally floors, a third of which were completely filled with patients that were dying from end-stage AIDS. And as program director, one of the challenges that I had was to try to ensure that our residents took care of more patients than those that just had AIDS. They needed to see patients with cardiac diseases and pulmonary and GI, et cetera, but there were so many patients in the hospital with AIDS that was difficult. We had to actually set a cap. So it's been very, very gratifying to see AIDS progress from an acute terminal illness that basically invariably would kill people to one which is a chronic illness that people live with, and they don't die from AIDS often, hopefully, but they die with it. Also, very, very impressive is the great strides that we've made in the care of cardiovascular patients. It was common in the early days of my career, and maybe even when I was in college and high school, to have fathers of friends and acquaintances die from heart attacks at age 45 or 50, 55. It was just not unusual. And today, because of the intense focus on evidence-based care in cardiology that has been supported by large national trials in many, many different areas, we really understand better what the pathophysiology is of coronary artery disease. We understand better what the optimum treatment is, optimum prevention and the optimal treatment of both chronic stable angina as well as acute coronary syndromes. And I think our outcomes are markedly better. Well, it is true that when I first came here, we were very department oriented and very siloed. And I think during the course of the 28 years that I was here, we have gradually and slowly moved towards collaboration between departments and between even caregivers. And so I think the interdepartmental collaboration is very important. But the other thing that I think has changed is this collaboration among caregivers. And so that means, for example, that nurses really, they're not in left field. They are very important partners in the way that we care for patients. And the team-based approach to care is it's mandatory in 2017. And if you don't have it, you really risk creating a system of fragmentation, and the person that's the most adversely affected is the patient. My advice to physicians is to understand why you're going into medicine. And I've said this many, many times over the course of my career. I went into medicine, or at least the rewards that I got from medicine were from two different sources. One was the personal relationships which I developed with my patients. Didn't take a lot of time, but to sit down and really get to know your patient as a person, find out what are their interests, and come up with one or two shared interests that you have so they know that you are interested in them as a person. Inevitably, developing that relationship is really rewarding for you as a doctor. And then the second one is to savor really the intellectual exercise of being a doctor, and having the opportunity to sort through a patient's symptoms and figure out what it is that's wrong with them and treat them and hopefully get them better, but in all to support them is a fabulous opportunity. So in some ways it's akin to being maybe a minister. It's a sacred calling. And I think, as a young medical student and an intern resident, young faculty member, you need to continue to ground yourself in those two things and take the opportunities don't rush so fast that you don't savor those two opportunities, because you're going to be buffered around. There's going to be change. There are going to be, electronic health records. There are going to be, constraints, restraints, new requirements. You name it. There's always going to be change, and it's going to get even faster than it is now. But if you can just take a few minutes each day, maybe each week, to step back and think about, be in the moment, and think about why you went into medicine, and continue to establish those relationships, and continue to understand and be get feedback and be rewarded, for the profession that you're in. I think you shield yourself against all of this change. And to my mind, there is not a better profession to be in, even with all the changes. But you have to continue to remind yourself.